everyone, Melanie with Empire Eye and Laser Center. I'm here today with Bryn to perform a cryofacial. It's using liquid nitrogen to help reduce the inflammation associated with her current breakouts, as well as to kill the P. acnes bacteria. The P. acnes bacteria is what's actually causing the congestion and the acne breakouts. And a lot of our treatments and opportunities that we have to treat acne here is really targeted at killing that bacteria. So we have a lot of different modalities. We treat very comprehensively when we look at acne. We can prescribe medications if it's necessary. We can perform things like cryofacials, which help to give us an immediate boost and immediate clearing of the acne within 24 hours. We can also do things like a photofacial, which helps to also, the blue light kills the P. acnes bacteria, but it can take away pigment related to old breakouts, redness associated with current breakouts. We also have skincare, which is your maintenance and the important component of what you're doing every morning and every night to, again, maintain the treatments that we're doing in the office. So we're going to start over here. If you can see, she has her breakouts on her right cheek that we want to take care of, as well as over here, but we're going to treat the whole surface of the skin because she'll get a light sloughing and a really nice glow. So what we're doing here is using liquid nitrogen soaked in cotton gauze to just rub over the surface of the skin. We're not using it as freezing, specifically a lesion like a wart or a skin cancer, which would actually leave the skin blistered and scabbing as it's healing. This is just using the cold temperatures to kill the bacteria, slough off a very thin layer of the skin to have fresh, healthy skin glowing beneath. And when you have something frozen off, it can typically be quite uncomfortable, but this case, it's actually very comfortable for the patient. So there are a lot of considerations with acne. It does affect women more often than men and across the lifespan, which can be very disappointing to learn after our teenage years. Hormonal acne is more likely to be affected along the jawline, as well as maskne. In this last year, we've had a number of patients that have had more breakouts in the area that their mask touches than ever before. And we also tend to touch our face a lot along our jawline. So that's an area that we always want to make sure we bring our products and bring our treatments down to make sure we're not missing what's happening underneath the jawline. Okay, Bryn, how did that feel?
Really good. I feel fresh and ready to go.
Okay. So you had a question about icing.
Right.
Tell me what you've seen that your question pertained to.
So I've seen on Instagram a lot of people just icing their faces in the evenings before they go to bed after their face is all clean, and they're using it to treat their acne somehow. How is this different from that?
That's a very good question. So icing at home is going to help with the symptom of inflammation related to an acne breakout. So help with, when they're bright red, they're very swollen and inflamed and tender, icing is going to help with the symptom of that. The liquid nitrogen temperatures are going to be more healing for the skin, treating the cause of acne, killing the bacteria, as well as taking care of the inflammation. So we just finished our cryofacial for Bryn, which was designed to help heal and repair the current inflammation and breakouts that she's experiencing. We have other treatment modalities in the office, like a photofacial, which can help not only heal current breakouts, but also reduce pigmentation and redness from previous breakouts. We can do steroid injections for cystic acne, medications as needed, including a ZO skincare regimen for your at-home maintenance. It's really important to look at acne from a comprehensive point of view, and we like to be that one-stop, all-in-one opportunity to treat your acne. So give us a call, make a free consultation appointment with Rachel, 661-325-EYES. We look forward to seeing you.